All right. Call the meeting to order. This is the meeting of Finance Committee, Stephenson County, Friday, October 10th, 8:30 a.m. We will start the meeting next with 2.0 prayer. I'll do that.
Dear Heavenly Father, we just thank you for the opportunity to serve the people of Stevens County again. Once again, we just ask you for your wisdom and the decisions I will be making today or deciding for next month as well. But we just thank you for the nice slow rain this morning. With that, we just let's move forward. Thank you, Lord. In Jesus' name we pray. Amen.
Thank you, sir. Item 2.0, approval of agenda. I have a motion to approve. Second. We have a second. Any discussion? All those in favor signify by saying aye.
Aye.
Opposed? Motion carried. Review and approval of meeting minutes from September 15th, 2025.
Motion to approve.
I have a motion to approve. Second. And a second. Any discussion? Hearing none, all those in favor say aye.
Aye.
Opposed? Motion carried. Public comment. Anybody like to come up and make a comment to the committee?
We're gonna do the claims first.
Oh, wait. How did I get past that? Okay, I need another cup of coffee this morning. Approval of claims this morning. We have claims in the amount of cash requirement $746,150.45 and annuals of $660,052.80 for a total of $1,406,203.25. What is the jury's pleasure for that? I have a motion to approve.
Second.
And a second. Any discussion on claims? Hearing none, all those in favor say aye.
Aye.
Opposed? Motion carries. Okay, now public comments. Anybody here to make a comment or committee?
I'm here representing the Wake County Mental Health Board. I'm president. My name is Carrie Mel.
Or do you want to come up here? So everybody can hear you, okay? That's okay. Yeah, if you could restate your name, just because it's a public.
I am Carrie Helm. I am the current board president of the Wake County Mental Health Board. So we're here to determine to see what happens with if we get to the auditing for our agency.
Do you have any comments for the committee in regard to that?
Sure. I think just nationwide and especially in our county, we've been hit hard with the mental health crisis. It's happening everywhere. There's such a shortage in funding for the services needed. FHN, even about a year and a half ago, closed their counseling center, and between Mississippi Center and Rosecrans that recently both came to Stephenson County, they have picked up just an immense amount of the work FHN is doing. A lot of providers are maxed out, but yet day after day show up and put in the work for, not a lot of funding, just always doing what they can. They care for people that need it the most. And so it's a huge concern that mental health is not funded appropriately. So we need, basically all the help we can get. The member agencies that we work with that work within our board, come to every meeting and just give us a wealth of information on what they're doing. And it's just always just mind-boggling how much work they do for so long. So it's definitely, I think, a healthy community has healthy physical health, healthy mental health, constituents, and it all works together. And anything we can fight for, we will, because it's that important. Okay, thank you.
Yes. Come on up. Please state your name for the committee. You have 3 minutes. I forgot to put you down.
I'm Jamie Culler with United Way. I'm actually here on behalf of Connie because she couldn't be here with us today. So good morning, Chair and members of the Finance Committee. Thank you for the chance to speak regarding continuing funding for mental health services in Stephenson County. I'm here on behalf of United Way of Northwest Illinois to ask for continued investment in 211 and for mental health services that keep Stephenson County residents stable, connected, and safe. 211 is our community's front door from August 1st, 2024 through August 31st, 2025. 211 assisted 552 Stephenson County residents, 6% of whom were veterans, 21% of mental health call to work crisis calls, and 14% are general counseling calls. For many rural families, seniors, and single parents, 211 is the only immediate confidential way to find help in the moment they need it, and to be warm transferred to 988 or local providers when risk is high. From a finance perspective, this is prevention that pays for itself. Minutes of skilled navigation can avert high-cost outcomes later. Avoidable ER visits, law enforcement responses, psychiatric warding at hospitals, or school disruptions. 211 reduces duplications, speed referrals, and limited capacity focused on those who need it most. And we know what happens when communities don't have accessible mental health services. People in crisis end up in ERs and jails, not treatment, driving costs without improving health. Schools see more absenteeism, behavioral incidents, and stress families. Employers see lost productivity and workforce instability. First responders become the default mental health system, increasing burnout and overtime. Most importantly, risk escalates. More preventable crises, more overdoses, more families in distress. We're asking you to maintain funding for essential mental health services. It's the highest return per dollar you can make right now. Fewer avoidable crises, lower downstream costs, and better outcomes for families countrywide. On behalf of our partners and neighbors we serve, thank you for considering the sustained funding for 211 and community mental health. It keeps our system accessible, efficient, and ready when people need it most.
Thank you.
Morning. I'm Liz Mosier from RAMP Disability Resources and Services. So thank you for the opportunity to speak today. When people think of RAMP, they often think of physical disabilities, but we serve anyone with a disability, including mental health diagnosis and developmental disabilities. In the last year, RAMP served 319 referrals and worked one-on-one with 84 consumers in Stephenson County. 58% of whom met 708 board definitions. We continue to provide unique, person-centered services that fill vital gaps in our community. When someone contacts our agency, they can speak with staff the same day and receive immediate resources and referrals to local providers. There are no wait lists, and phones are regularly staffed to ensure timely support. This past year, we've seen an increase in youth with dual diagnoses, such as ADHD, anxiety, learning disabilities, and behavior disorders. Our staff have provided ongoing support and advocacy within schools to ensure these students receive the services they need. We teach parents their rights, and students receive the services that, we teach parents their rights and attend IDP and 504 meetings alongside them to ensure their voices are heard. Our independent living team also continues to develop targeted goals and objectives to meet the needs of adults in our programs. Currently, RAMP staff are working with a group of people in our community who are losing their supportive housing. Our team is helping them find safe, accessible housing in less than 60 days. If some of them get placed in nursing homes, our programming can help transition them back to independent living with support, saving the state money while restoring independence. We are committed to continuing this advocacy until every individual can secure housing that meets their needs and allows them to live independently with appropriate support. We're excited to share that RAMP is launching a new peer support group in Stephenson County. The support and services provided not only increase independence, but also reduce the need for emergency interventions by helping people address issues before they reach a crisis point. Through stable housing, healthcare connections, benefits assistance, and support system, which will help decrease 911 calls, emergency room visits, and police involvement. We help individuals navigate local providers, access legal support, and secure housing, understand their educational rights, and gain employment skills that lead to independence. RAMP and our partners within the 708 board network continue to work together to ensure that no one falls through the cracks and that our community's needs are met. Thank you for your ongoing support and partnership.
Thank you. Thanks.
Good morning. My name is Brian Babcock. I'm here today on behalf of Malcolm Eaton Enterprises in Freeport. For those of you who may not be familiar with Malcolm Eaton Enterprises, we're a local nonprofit that provides services and programs for adults with developmental disabilities in Freeport and surrounding communities in Stephenson County. We are a locally founded charitable organization. We were started in 1966 by a group of concerned parents and community members. We are a recipient of 708 board funds. Last year, thanks to the 708 board, we were able to provide over 38,000 hours of unfunded service to over 100 clients living in Stephenson County. Very briefly, I'm just going to tell you a little bit about the groups that the funding helps and how it helps them. I look at what I refer to those two service gap groups as the unfunded and the underfunded. So the unfunded, as you might guess, are clients who have developmental disabilities living in Stephenson County that don't have funding. Why don't they have funding? It's a great question. So there's currently statewide in the state of Illinois a waiting list of over 16,000 individuals who are eligible for the type of services offered at organizations like Malcolm Eaton Enterprises, who are currently waiting for funding. If there is a student in our current school system, when they age out at the age of 22, they typically have to wait 3 to 5 years to receive funding for the services that they are eligible for. So one of the ways that we utilize the 708 board funds is to serve as kind of a bridge from that school system where those funding and supports are guaranteed to the adult system where they're often delayed by 3 to 5 years. So that's one of the ways that we use those funds. The second way is for the unfunded. That's an even easier group to understand because the underfunded are everyone that we serve. So after someone ages out of the school system, waits 3 to 5 years and is awarded funding from the state of Illinois for services, they're only allocated $1,200 of service per year. If you divide that out over the course of a year, it's about 100 hours a month. It's barely over half a day of service. We know from the 60 years that we've been operating in a community that a full day of service is very, very important for our clients to get the best possible outcomes. So we use the remaining 708 board funds to add additional hours to the people who are funded in the state so that everyone in Stephenson County, all of our clients have the ability or the option to attend services for a full day of services. So I want to thank you again for the opportunity to be there. The 708 board is absolutely vital to allowing us the ability to provide the best services as possible. So thank you very much.
Thank you, sir. Anybody else?
Morning, I'm Jake Wagner. I'm the superintendent for the Veterans Assistance Commission here in Stephenson County. I know the board has always supported us very well, and we appreciate that. We're just wanting more continued funding from the board for all of our veterans. We are now seeing a very big uptick in our veterans needing assistance due to cost of living allowance, rental increased prices. We're also starting to get a more older crowd in so that we're providing more rides for medical appointments to Madison. We've been going to Chicago, Rockford, and locally. So everything that we have right now is on the uptick. So we're just looking for your continued support.
Thank you, so Jim. Anybody else? Okay. Thank you for your. 7.1. Ms. Bright, you got the floor.
Thank you. Good morning, everyone. Happy Friday. I am here to discuss the property casualty work comp renewal as well as the benefits renewal. Yeah. We'll go through the easy one first. Property casualty, just a brief overview. We insure lots of buildings, contents, and inland marine. Those coverages, I can go through details if you want. We've been through this a number of times. If you have questions, please stop me. There's a $5,000 deductible for off property. There's liability coverages in the form of general liability, public officials, which is you all, employment practices, cyber liability, sex abuse, law enforcement liability, and professional liability. Those coverages are $1 million per occurrence and $3 million in aggregate. There is an umbrella over most of those liability coverages. We bumped that umbrella last year from 5 million to 10 million. The deductibles there are listed. Work comp is unlimited liability, has a $50,000 per claim deductible. The auto coverage, we have 108 units valued at about $5.6 million, and the liability is also $1 million. Really quick, I'm gonna run through claims. All open claims here are listed. Total incurred is, total outstanding is 126,000, 40,000 paid. Just really quick, current claims in this policy period, which is December 1st of 2024 to December 1st of this year. There was 2 auto accidents, 2 notice only employment practices claims, a pipe burst. Public officials, 2 claims, 1 notice only, and 1 it has a 15,000 reserve, and then there's 11 claims for 15,000. Any questions on those?
We moved that umbrella to 2 million last year.
We did, yes. Here is the summary of the premiums over the last couple of years. 2 things I want to touch on this year. The premiums have gone down if we exclude the nursing center completely. Going from 807 on the package meaning the liability and property and auto, everything except for the work comp. You can see a significant drop there. The work comp drops just a little bit just because of payroll. The payroll is moving to the management company. So you can see there's $171,000 savings by excluding the nursing home in its entirety. In the green column, we would include the nursing home liability coverages, and that has an uptick of general liability or liability coverages. The work comp is the same, still a decrease in premiums of 97,000. I'll get back to that in 1 minute. The overall insured values are slightly up across the board. Nothing that's going to swing the needle there. Claims are down, property values just slightly uptick just before inflation and replacement cost purposes. Any questions on that right now before I get into this green column?
Surprised it's not a big.
In which column?
No, just that the actual liability changes, it's bigger between.
With and
between
without?
the nursing home,
Yeah. The big difference is the nursing home will be excluded from the excess liability. So let's talk about this green column. I'm going to recommend we stick with and keep liability coverages for the nursing home until it is completely jettisoned off the books. The nursing or the management company has care, custody, and control, so to speak, of the operations of the nursing home. We, the county, are still insuring the property and the automobiles. So once that's completely sold, the assets are sold, that'll move the needle a little bit. I do recommend we go with the green column and keep liability coverages for the nursing home. Here's why. If something happens at the nursing home and there is a lawsuit, the lawsuit likely will, of course, include the management company as well as the county. Anytime there's something that happens over there, you still own the assets, you still have that premise liability. Any lawsuit that's coming in is going to cast a wide net and bring everyone who is remotely involved in the operations is going to get pulled in. We want the management company to have the primary, which they do, coverage. Ideally, the management company should have the same coverages as the county. We are working on that. But again, based on the litigiousness of our environment, I would recommend we keep the liability coverages for the nursing home until it's completely off. And so that's my recommendation.
Mr. Chairman,
Yeah.
next question.
Please.
Help me understand why we would keep workman's comp on the green column, even though we no longer employ any
You're not.
of the,
There's no nursing home employees in the green column.
thank you.
Mhm.
Why is there no impact, but nursing home employees without a working staff?
Sorry, I should have, that's my mistake. In the yellow column, there are no nursing, there is no work comp for nursing home employees in the yellow nor the green.
Oh,
Sorry.
that makes sense. Any other questions on that page?
Yes. Benefits, our favorite subject. This is just a run through really quick from 2024 to today on the plans. We got rid of the zero deductible plan in 2023, moved that to about a $1,500 deductible or $1,000 deductible, excuse me, PPO. Last year, that $1,500 moved to an $1,800 deductible. That is the lowest HSA deductible offered by Blue Cross Blue Shield. This year, that's the same, and then the $2,500 deductible PPO moved to a 27. Again, that's the lowest in that plan design. You can see the number of employees right now. There's around 166 employees on the plan. This number is very fluid. It fluctuates back and forth. It can go down to 162, can go up to 170. This reflects the nursing home employees moving off of the plans. Okay. This is difficult to see. If you have a paper copy or something in front of you, you might want to look at that. This is a very good overview of the status of the health insurance for the county. We've talked about this for the last probably 5 years. I highlighted some summaries there. So what this is an assessment using one of the carriers we utilize for benefits quotes. They take the Stephenson County data and run it through their proprietary iterations, including using AI. And this is a very good summary of the snapshot of what the plan or the benefits, I should say, medical looks like. The bottom line here is we're still running at a loss, meaning the claims paid are still more than the premiums collected. And there's various reasons for that. Again, we talk about this every year. There's a higher amount of high cost claimants, and there is a higher in specialty drugs in the plan. That those two things are very, very expensive, and I will have a recommendation to try to target that and help that here in a little bit. Again, just kind of showing you that we have tools in our toolbox to analyze the benefits to make sure that we are doing the most optimal things we can do. Any questions on that? This is a nice snapshot of an assessment of the plan. The risk score is 4. You really want it to score between a 1 and a 3 to be able to go out and get other options. Right now, a 4 or 5 means we don't have any other options but to stay with a fully insured plan. This is marketing summary. Again, we talk about this every year. We do knock on the door of a lot of different carriers. Most decline to quote because they can see the claims are outweighing the premiums, or they do quote and it's more expensive than what we currently have. So this is a high level summary of what the renewal looks like. It is a 15.8% increase over last year. This is considered a pretty good renewal. My average Blue Cross Blue Shield fully insured renewals are around 20% up. And again, just further supporting the increases, there's high cost claimants are really pushing costs. I'm not gonna go through this slide, but you can just kind of see the trees there, and that has been the trend for a while. Any questions?
Why doesn't the, release of all these employees from the nursing center impact that way? I would think it'd be closer to being flat, just because of that.
The
Maybe I'm missing something.
nursing center employee claims have been on there for most of the year. So they're really looking backwards. The total cost will be lower because you're only carrying 160 to 70 employees versus 190 to 200.
Right.
That remains to be seen, in my opinion. You know, due to HIPAA, I don't know who the high cost claimants are.
Sure.
I don't know who the high drug cost claimants are. If they happen to be nursing center employees, then yes, we'll see that come down. If they don't, they'll still be there.
But just in a general sense, I mean, if you're going from 200 to 150, it's just a profound number saying. That's a quarter of your workforce.
Mhm.
And yet we're still achieving 20% or 70% increase in premiums.
They're looking backwards at the claims. So they only have claims data up until when they ran the quotes and ran the
They
analysis.
can't project that based on that.
It's not yet. Yeah, and again, hold that thought. I have a recommendation that we're gonna
I
talk
understand
about
what
in
you're saying now,
detail.
but no, that makes no
Yeah.
sense.
Yeah. Here is a drill down, so let me go back. Expected premium at current rates was around 4 million. Expected premium at new rates around 15%. So they come out with a 17-ish% increase. We do get a 2% discount for keeping the ancillary coverage with Blue Cross / Dearborn. So that brings it down to about 4.6 million. So that's at a high level. 4.6 million will be the total premium medical spend based on about 170 employees and their dependents on the plan. Of course, the county doesn't pay for all that, but that's just the total. Here's a drill down look at the rates. You can see each plan going up by that 15%. Any questions on this? The county does contribute to the to anyone who is in an HSA plan. Last year, these were the deposits. This year, I assume they will be the same. Okay. Dental went up commensurate with the medical, about 16%. This is based on 193 employees on the plan. We have asked them to redo these numbers based on 170. I have not had those numbers. I don't expect this to change very much. The dental spend you can see is about 167,000 total at 193, so it'll be 150, 140 something. That's a very small portion of your benefit plans there, so. We will still keep the dental, vision, and life with Blue Cross Blue Shield because again, we get that 2% discount on that. Okay. The life, accidental death and dismemberment and vision stayed the same, and we have a guaranteed rate through 2028, so that's good news. It's a rate lock, it's really good news. Again, not a huge spend in terms of the overall picture. Any questions so far? Kind of ran through that pretty quickly. Okay. I I am not gonna take a show of hands, but I would love to have a show of hands and who watched that video I sent out on RX Mapper or Function Health. Georgia, I should have brought some prizes. I really hope that you do get a chance to watch it. I am going to recommend that we implement RX Mapper. RX Mapper is a DNA sequencing where it's all HIPAA compliant, all confidential. In a nutshell, at a high level, RX Mapper will send out DNA collection kits, which is just a cheek swab, to those who have been identified that are on higher cost drugs. And they map the DNA versus the drugs they're taking. And you can see some statistics here that 48% of population, 48% of drugs prescribed are in the wrong drug or dose. I think if you think in your personal life, you probably know someone or personally have. If you struggle with, if you take certain prescriptions and it just doesn't work and you're constantly going back and looking at different types of prescriptions or different dosing, this is what attacks that. 75% of cancer drugs are the wrong drug or dose. And it's a huge impact to costs, specifically Stephenson County. RX Mapper has proven reports that they reduce the growth of high cost medication plans by up to 15%.
That's voluntary.
Sorry,
That's voluntary.
meaning
They send you a kit, it's your choice to take it or not.
I'll get to the, yes, it is. How does it work? It goes through the sequence there. It is HIPAA compliance. They don't share any information with the employer. The DNA kit arrives. You do the swab, you send it back, they do the analysis, and then there's a telehealth consultant with that employee. Again, I'm not gonna read this. This is for your consumption there. My opinion and my advice as your benefits advisor, this group generally is a bit unhealthy. You could see the statistics that we gave. You know, it's on the older side, mostly male over 45. I don't want to get into stereotypes, but males typically don't go to the doctor. They don't do wellness screenings. So there are a lot of different ways to help and impact with preventative type things for a group. We have tried a lot of different things and we will continue to try. We do employee outreach, we do employee emails. We talk about the importance of healthy eating, exercise, watching, everything. That really hasn't worked in the last 5 years. In my opinion, this is a very passive way to impact health, high drug costs, and the medical procedures associated with people on specialty high cost drugs. All it is a cheek swab sent in, they sequence it, and then there's telehealth consultants, and then they can adjust medications that hopefully impact not only the quality of life, but their health as well as the cost of the county. So with that, it is remarkably cheap to implement this program. Generally speaking, for a population of 170 employee group, generally speaking, on average, RX Mapper sees that they help about 3 people out of 170. If they do go ahead and help 3 people with all the costs, it's cost for just, if it only helps 3 people, the cost of this service will cost the county around $7,000. The annual savings for both medical and drugs generated by spending $7,000 is $63,000. It's a 9x ROI. This again just breaks down, hey, it is a cost per member per month. based on 170, the bulk of the cost is $4,000. And then every person who does the DNA collection, the sequencing, the telehealth, it costs between $300 or $100 and $300. So again, this is the breakdown of helping 3 people. It's about $7,000. I also have them run additional quotes for me. So if they happen to help 5 or 10, let's say they help 10 people, the cost goes up to 14,000. And they are estimating it will generate $207,000 in savings, a 15x ROI.
And that's gonna impact the cost. So
Yeah.
it's really for high risk, quote unquote, high risk folks.
Generally speaking, yes, but they do chronic as well. So the county has a lot of chronic, so diabetic, cardiovascular, musculoskeletal, both procedures as well as prescriptions. That is the target, is the higher cost chronic. So again, not all 170 people are gonna get sequenced.
To implement what you're saying is for 170 people, it's gonna cost $2 grand.
Yes, if 3 people go through the sequencing.
No, what I'm saying is, then it's up to them, the employees, if they're gonna use it. It may have a bigger impact for more people that use it.
Correct, yes. So that's why I had them run. This is variable. So if you do decide to go ahead and implement this, my recommendation is to approve the higher amount, assuming, say, 10 people will use it. Budgeting for that 13,000 in costs, and maybe only 3 or 5 use it. But you still, so you can budget it. In my opinion, my estimate, I think the max cost is going to be that 14. I do think more than 3 people will be sequenced. How many, I don't know. So that's why I had them run 5 and 10. So if as a board, I would recommend you approve the 10. Maybe 3 or 5 or 8 people will get sequenced. But you can't not look at this 6-figure savings here, 100,000, 200,000. The more people that get sequenced, the more savings there's going to be. Again, this is, how it works is they will look at claims and send out employee communications, and they will send out targeted communications to get those who are on, certainly target the high cost drugs, high cost claimants, get them in the door, get it sequenced, start working with them. And so it's a telehealth consultant. They hold their hand the whole way, and they have a lifetime help for those that want it. Again,
I'm sorry.
go ahead.
One of the things that I was curious about, from your perspective, there's been a lot of talk about the impact the federal government's had on the cost of drugs in this country at this point.
Yes.
Some of the changes that may occur because of some of the things they're doing. From your perspective in the industry, how does that work?
Any time that you can help impact the cost of drugs, I think it's a good thing. I think it remains to be seen. It's too early to tell. I do think, my opinion, and I've always said this both on the property casualty work comp side and the benefit side, prevention is the best insurance.
Sure.
Prevention is the best insurance. If you can prevent yourself from diabetes, cardiovascular, heart disease, and that's lifestyle. We all know it. Do we implement it? Of course not. But getting that, in my mind, is going to move the needle the most. Getting people more active, getting people more engaged in their healthcare, getting people more engaged in their diet and exercise is going to move the needle the most. Absence of that, my opinion, in the healthcare industry, we certainly have cutting edge everything, right? No one's getting healthier. We're spending more and more and more on healthcare in the United States. No one's getting healthier. I don't know what that equation is. In my opinion, prevention's got to be the thing. I also sent you all a video on Function Health. Function Health is it's a wellness type thing where you go and you get blood work. And the blood panel is way more exhaustive than you do at your normal everyday checkup. And then you track it yourself, you have an app on your phone, and it kind of digs into and is more preventative. Doctors, in my opinion, treat symptoms. When symptoms show up, that means something has been there for a while. The function health, it gets out in front of it and says, hey, let's have a look at this. This is a marker we see that could start pre-diabetic or cardiovascular issues. That the function health is a little bit more expensive. I will absolutely send communications to the employees to encourage them to do it. You do have to go get a blood draw, do have to take time off work to do it, but again, it's preventative and managing your health. This is very, very passive, easy to implement, cheap to implement. 14,000 for 200,000 in potential savings. And that is going to be ongoing. So that's both medical and pharmacy impacts. And if we can keep doing that and saving a couple hundred or 100,000 each year, we can move that needle so that we have more options instead of a fully insured Blue Cross Blue Shield. I don't know if that answered your question.
Yeah.
You know,
Well, I would agree 100%.
I have a question, Mr. Chairman.
One second. With that, it seems like the trend in the medical community is on more towards just putting Band-Aids on stuff and drugs instead of really giving it the cost back.
I agree.
So that's, and it's what,
Say I'm on a drug for my pancreas, that's very expensive. And they recommend that I go to something else. Am I required? Will they stop paying for the drug I'm taking now?
No. This is outside of Blue Cross Blue Shield. They're gonna provide you with a recommendation that you could take back to your doctor and say, hey, by the way, RxMapper works with the Mayo Clinic. I can send you all kinds of data and they have all kinds of background data and proof that this really works. So they are telehealth consultants. You get on the phone, they'll tell you, hey, we recommend going from here to here, and this dosage to that dosage, whatever the case may be. You would take that back to your doctor and say, hey, what do you think about this? And it's your choice.
I could just see people saying, well, they're just trying to save me money, they're trying to save the insurance company money.
And I think, I'm oversimplifying this process. I believe that the telehealth consultants really hold people's hands and say, hey, tell me something. Do you have this symptom, this symptom, this symptom? When you take this drug, you're kind of tired of feeling crappy.
Right.
Maybe this will make you feel better. And here's why, and here's the data that we see.
Sounds like a great plan.
I can't,
People are skeptics,
people are skeptics, of course.
If you can make them feel better, that would certainly,
Correct. That's the motivation, right?
right.
It is frustrating. I think if you are in that chronic condition or have cancer or something that's chronic, it gets old really fast. And I think that people would be motivated to make change if they are shown data that, hey, it works. I look at it anecdotally, everybody's different. You can't give the same drug to everyone, that we're all built differently. So that's the premise of this. So I do really encourage you guys to watch that webinar. It's really cool. I have slides after slides after slide I can send you. I think it is worth a shot. We have, again, easy to spend the county's money, but this ROI, these ROIs are crazy. 10x, 13x, 15x ROIs, spending not a whole lot of money. I think it's worth a try.
Sir, Karen, how old is this company?
Good question. 5 years? I'll get back to you. I don't know.
I just approximately 5 years. Why doesn't Blue Cross Blue Shield deal with it? Seems like we're at the wrong spot in the process.
It's a good question.
Blue Shield has no motivation to do this. They're making a lot of money. When they charge premiums, you're paying for the care anyways. It's not like, it's very, very difficult to exchange it. I could spend an hour thinking about that. I don't know that they have any motivation to. They say they do a good job. they'll keep paying for expensive drugs because they're gonna make it up in premiums. There's no motivation for preventative things in my eyes. I can, instead of, I could, again, I don't want to take up too much time, but I can send you some information. I will email the board my 2 cents on why they won't do it.
Please accept my apologies for not watching video. Sorry for.
Apology accepted.
Okay.
Yeah, I have the ball on that, so that's.
Yeah.
I think out of the department heads will be too much.
Yes, I did get, I did get, feedback from one department head, which I was happy to get. Again, engagement, education, that's really gonna move the needle for us. I please ask you guys to have a look. I value your time and would not send something to you if I didn't think it was. So I really believe this is important. I think it's worth a shot to implement. So I recommend we do this.
Adrian, is this reflected in the budget recommendations to this point?
Not at this point, no.
No. So we would have to add that in as we go through this. Just one for the community.
So if you think about it, we're spending 4.6 million, give or take, on medical. We're spending 150,000 dental total, again, total. You can do the math. If you want to spend another 13,000, I don't know what 0.1% that is. I don't know if that's good. Make some go, yeah, $1,000 a month for 200 in savings. Now, caveat, this is a long term journey. I'm not saying that you're gonna see a $200,000 downtick in your premiums next year. This is a journey. We're not gonna make a big right-hand turn right away. This is 3 to 5 years out. If we can continue to save a couple $100,000 a year, move those claims down, rates won't go up as high. Hopefully, we get the claims down to where we're not in a negative loss ratio situation. Then we open up to self-insurance eventually. Self-insurance is you control everything and it's a lot cheaper. You're not handcuffed by what Blue Cross Blue Shield is going to give you. So I just want to make that caveat. This is a long-term investment. It's not a one-time overnight thing.
Good. Any other questions for Jay? So, thank you very much.
Okay, really quick, go no, sorry, don't go ahead. I'll let you finish. I recommend we keep the current plan design, stay with Blue Cross Blue Shields. We don't have any other options. I recommend you implement RX Mapper. Approve what you're comfortable approving. My advice is to approve the $14,000 spend. And I'm gonna guess maybe that spend actually comes in at 8,000 to 9,000. We will, of course, continue employee communications campaigns. Our goal is to educate, engage, and help your employees be better consumers. We will roll out and send information to employees about function health as well as root health. Root health is another preventative type program that would be voluntary for employees. I will try to continue to engage the department heads more this year. I think that helps get their employees engaged. Of course, continue the county contributions for the HSA, that's all. Any other questions that I can answer?
So neither liability or health premiums are action items on tonight's agenda, but because Carrie and I weren't sure where the renewal numbers were gonna be, if it was an approvable point. She is available to come to the county board meeting on Thursday if we get a consensus to move that recommendation forward. Can't take action, but we could at the board.
Where you get that?
I do that.
Yes.
So just so you're aware, none of the numbers are in the budget at this point, so I've highlighted funds that we cannot tackle today because of that.
But you do have an idea of how it impacts things.
Yes.
So she has
Yes,
provided them, and we can discuss that.
yes.
Okay. All right.
Next steps, really quick, obviously, we need the committees and board approvals. We would then populate the online open enrollment system with ease. Tentatively open enrollment would be from November 10th to May 1st, give or take. Again, it's all online. Myself and my counterpart Terry Compagnon are always available for questions. Terry gets a lot of questions from employees about various billing issues, procedure issues, and anything. She answers a lot of questions. We will continue the ongoing monthly and department head communications. And I do recommend, implementing the RX back-to-back exam starting January 1st to coincide with the benefit renewal, which is also January 1st. So we will start the RX back from school. We could start it earlier. But having it coincide with the 1/1 makes sense. Any other questions I can answer? Nothing. Thank you.
Thank you. Madam Administrator, do you have the floor?
Yes. Well, so, so we can get to the budgets. I will try to be brief. Most of you have already heard my report or, seen it, so highlights, working with the nursing center on getting the audit information completed. Check what Adrian here, but I would say about 2/3-ish of the information was submitted yesterday instantly. There was follow-up questions from our auditors, which were sent back out. I did not see a response this morning. Hopefully, I will be following up after this meeting. But actually, those remaining items.
What's that impact with audit? Hanging the balance here.
Well, that's why it's not done yet. There's been deadlines that have been like
How are they gonna be able
this.
to finish it if they don't know? So.
Exactly, that's the issue. We've made the nursing center aware that it is impactful with our state and federal funding, especially with highway department road projects. They basically fill out a survey that, and a clear audit is one of those questions. And so if they do not have a clear audit, they get penalized. So that could affect amounts, timing. Yes, so that's why we're pushing so hard to get this done. This is the only thing that there's a few questions and that's it. That's all we need. Everything else is completed. So Lindsay with Sigich said if she does get the information by the end of today, she will expedite the process to meet October 30th deadline on their behalf. Because we did receive some notification that we would be placed on an Illinois stop pay list. We've since gotten further communication that the entities don't always do that. So it might not be as impactful as we originally thought, but it's not a chance that we really want to take. This should have been done months ago.
Right.
So that's where we stand.
Because again, this is still not the what's from last year.
Yes.
Department head meeting, we did talk about program that Carrie just spoke about and, preliminary insurance concerns, things like that. There has been obviously the emails I keep sending you guys, a lot of vendor correspondence. That are coming from the nurses out of my office that we're working through it all. Those are kind of highlights for me. I did mention that Wednesday is my 7th anniversary. So that's all I have.
So you said the department heads, you had some correspondence on this RX mapper.
We did.
program? Was
There
there a
was,
census one way or the other?
because there was only 2 of us that had really watched and kind of understood the dynamics of it. They did say they were going to watch the finance meeting to hear Carrie explain it a little bit better. It was mixed. A lot of questioning, like, Am I gonna be targeted? Is it gonna be my premiums? And questions about if their providers would follow through with the recommendations. So there was a lot of preliminary talk. I think if we do this, I'll work with Carrie to maybe have her attend a early year department head meeting and really push it home with the department heads of who is actually targeting, who would be involved. Of the procedural list, who could benefit, right?
If I could just jump in really quick, I'm going to send the committee members the slide deck, which I think is 40 slides. It gives you all of the information you need. I will send that to the department heads. Okay.
Super. Thank you. All right, anything else for?
Mr. Chair,
Oh, yes.
ideally, I would like to have the health insurance decision made at next Thursday's board meeting. Can't take action here, but you can get a consensus. Really don't want to go through this budget process without having a good idea of those premiums. Otherwise, the first swing at this for the county board will be in November, when we bring the budget to the board to be laid over. That's too late. I really do not want to have a special county board meeting. So I know it's late coming. You have not had much time to look at this, but if you can get a consensus today on that, review it between now and Thursday to make sure it's something you still want to proceed with, or if you want to take a different direction. But I would like this to be an action item at the county board.
Understood.
Please.
Mr. Chairman.
Pardon.
Thank you, Mr. Chairman.
Sure.
All right, Madam Finance Director, and I believe you are next.
Yes, I really don't have a formal report and someone has questions for me.
So just going through the items in the calendar update. So we're gonna work on the budgets today, obviously, we're going through supplemental requests, I'm sure you got information on that.
Yes.
So health insurance options, which we did, active insurance role, which we discussed. So that's good, okay? Keep moving. Treasurer's report, I think everybody has a copy of that, unless somebody has questions on that, I'm sure you can email question. But that's the same report that we get every month. That's not the chief. What's that? Yeah, it looks like there's. Keep moving. Review and approval of proposed fiscal year 26 budgets. So. We have the revenue section. I think, Adrian, we're gonna go through these one by one as we review. Who's got it? It's not. So we just. It's for everyone's benefit here. I got a hard stop at 11:30, so we're gonna get through as much of this as we can in the next couple hours. It's gonna be a good day, and we'll have to decide if we're gonna do it. We still have something.
Let's do it.
Yeah.
Okay. I first wanted to address the real estate tax levy options. Just for informational purposes, the last from 2020 forward, we did approve an increase in the 2020 payable 21 taxes and the 22 payable 23. So that is the last time that we did this. There is a potential to increase our levy request up to 5%. That is what is allowed under PTEL. We are a tax capped county. So unless we want to have a truth in taxation hearing, we have to abide by this rule of 5% is our allowable maximum. So you can see it's based on, and this doesn't look like my previous spreadsheets. I feel like it was a lot of information kind of in your face and it didn't really make sense. So this was our 2024 levy request. This is the final extension. So this is what we base our percentage on. This is what we received. You'll notice that I subtracted mental health because they are not included in the cap. So taking mental health out of the picture, sorry about that. And then multiplying that by 0.5. So this is our potential amount of dollars for the increases, the 509,000. So if we did that, the general fund levy request would be 6.866 million. IMRF would be reduced. And then mental health is asked for an additional $9,000, taking their levy request to 425,000. And the VAC asked for their maximum allowable rate. So since the rate is figured at a later time, I talked to the county clerk and we agreed that the amount of 340,000 would get them up to their max rate. So that is added in there as well. So that's that scenario. If we do not increase our levy request by 5%, you'll see it in this column right here. So this would be the amount for the general fund. IMRF would still be reduced. And then the mental health board, 708 board and VAC would get their increases. So these are just a couple of different scenarios. We can choose any percentage between 0 and 5%. Right down here, you can see that this is a huge question every year. The CPI is included in the calculation, the overall calculations of our taxes. So when people ask, should we take the CPI? Well, it's kind of already included in there. So does anybody have questions on this? These numbers are what currently are figured in the budget that you see. I did not include the additional 5%. So these are the numbers that we're working with at this point. But during this meeting, I can change those.
So if there's a 2.9 CPI increase, why is that not impacting?
Because it's in the backside of the calculations.
Oh, it's still gonna be higher dollar.
So in that
Overall.
5%, is it in that 5%?
It's not in 5%.
No, that's what I'm saying. So we should be getting a 3% increase regardless.
It's just what we request. It's not,
Well,
we
what-
get 3%. It's
No, but what you're saying is it's already built into the equation.
it's built into the equation once we make our requests, yes.
Because what I'm looking at is you've got the 2025 final extension number, 5,734,565, right? That was the total we brought in 2025 based on tax collections.
Yes.
The implementation of whatever the CPI was last year. I don't think we did any slashing.
We did not, but you can see this is our request. That's what we asked for, and this is what we got.
But the amount of change without the 5% increase, to 621.
And that's rearranging the levy. So we're taking that money from IMRF and putting it in the general fund.
Okay, because we don't have as big an IMRF and contribution because of employees in the nursing center, but why is that?
So the rates went down. And the way our financial software is set up, it was calculating our expenses incorrectly. So we were flush with cash in that month,
Picking up 600 grand.
yes.
Is
In the
what
general.
Everybody be clear. Now, including that, then why isn't? I still don't understand if we're getting a 2.9% CPI increase in the background. Why that number at the end of the day, without 5% increase, doesn't bump. I mean, it is bumping up. What am I saying? It's 5.734 to 6.356, is that right?
No, this is what we requested. and this is what we received.
No, what I'm saying is, we got 5734, 565 in 2025.
Yes,
With the 621 adjustment,
yes,
that's not an increase. That's just moved down.
that's just moving dollars.
The 635, 6284 without the additional 5% is cooking the equation already. So we're already getting an extra $600,000.
Because we're moving it from IMRF. We're
Okay,
taking 770 away from the IMRF request and allocating it to the general fund, mental health, and VAC.
we're not on the same page yet, because what I'm saying here. The 3%, what's 3% of 5734,
The 3% is not calculated, it's not an automatic thing, and I can go back to. It's in our limiting rate right here. All of these calculations have to take place to get to the tax rate, so it's not an automatic 2.9%. It's baked into all of the calculations. I'm just saying that it's taken into account. It does not mean we are going to receive 2.9% more
Right,
in tax revenue.
okay. Seems like that should impact that. To a greater extent than what we have.
Yeah.
If it's up 3%, it's up 3%.
But we're not asking for more than that.
Yeah. What was the AV last year?
So the rate setting EAV was 85 million.
Was that up, down, you know?
So the year before, it was 875 million.
So that's a.
So you gotta think that's baked into the calculations as well. I just want to make sure that everyone understands it's not going to automatically give us 2.9%.
Right, but what I'm trying to say is there is gonna be an increase without increasing that to 5%. You would expect
Possibly.
to bring in more money with a higher EAV and with the CPI cooking wages.
It's possible.
So.
Can I ask just one quick question?
Sure.
We're just talking about moving money around. We're not talking about
Yes.
raising anybody's taxes.
It's an option to raise. We have that option.
We can go 0 to 5%. We can increase people's taxes on their property taxes
Okay,
up to 5%.
so we are,
The last
we're
3 years since I've been chair of this committee, we have not increased it. Sign that.
thank you. What's the day what did you do?
2021 and 20.
21.
So I'm not a big fan of that. We can get away without it.
I agree with that.
I don't think we should have that. We should think of this stuff. So you got a big one, but can we call the school district and ask for a decrease?
You can go to their budget meetings.
This, that's, I'm about to, I'm telling you, all my reason that what we're taxing. Okay,
So just to point out, these numbers are adjustable. I'm sure all of you got the email from the treasurer yesterday. So there's some new legislation coming out with VAC possibly. So that's a factor that can be considered. So I just wanted to make sure that everyone understood this big picture and that we are currently using these numbers in the budget that will be presented,
not the 5%.
not the 5% increase.
Thank you. I appreciate you taking that approach. And I think it's shocking.
So, this is the budget summary. So this outlines every single fund and the surplus, if there is any. The funds highlighted in red and pink, they are impacted by health insurance. So these are the funds that we probably should not tackle today. There's not many.
Which one's Adrian, the ones in red?
The ones in red, and then general fund, obviously, there's many departments, so there's only one section of the general fund that cannot be approved because of health insurance. Same situation with public safety. And we'll see that, we'll go through that.
So, Mr. Chairman, is it your understanding that if we, as a full board, approve if we come to a consensus on the number for the healthcare and we approve that at board, we would have to come back then at finance and look at these and then do the final approval in November?
Adrian can put in the revenue number or the expense number now. Do that today, couldn't you? On the health insurance.
It's calculations because there's certain percentages for each fund. It's not like I can just plug in the whole premium and be done.
Doesn't have to come back to finance, but if you start approving these without those expenditures added up, then yes, they'll have to be revisited.
Because you want to go through every one of these at the county board, yeah? So,
Won't.
yeah,
You'll have to have special
that's what I'm
finance committee
saying.
meetings.
Just want everybody to hear that.
It will have to be the budget process at the county board.
Right.
I just wanna I would like the departments, especially highway animal control, to be able to see what the impact of their budgets will be.
Sure.
I don't think it's gonna be a drastic change. I think they'll be fine, but I just would like them to have that knowledge.
We gotta do it. Sure, I'll keep it. Backlands going forward, no.
Well, fingers crossed we get it done by the end of the year. There's no other option in my mind. It needs to be done. So, okay. So these are the general fund revenues, as I mentioned, the real estate taxes, the amount without the 5%, but the reallocation of the levies is there. Income tax, there is a portion, 200,000 going to capital fund as well. We have $3 million of cash carry forward to balance the budget, as well as a transfer from ARPA. This transfer was budgeted last year, but it did not happen. We did not need it. So I moved it into 2026.
What is that for? Because we have to spend that on something to say.
You can do it for revenue loss.
Oh, really?
Yes,
Okay.
yes. So I do have that. So you see the revenue amount right there. Currently, you see the revenues, expenses. This surplus will decrease slightly because of the health insurance. But it's not much, but we might hit zero. I don't know, we'll see. It's gonna be close. Does anyone have questions on the revenue side specifically?
Can you elaborate on the cash carry forward, please? For everyone going from 2.8 to 3 million, the reasons for that.
We did use 3 million last year to balance the budget. There were a lot of personnel wage increases last year, a little over $1 million. And that was mostly with the sheriff's department, with union negotiations. This year it sits between 500,000 and 600,000. Just the overall cost of everything. I think a lot of departments increased their requests just because of increased cost of items for their offices, including personnel. So
Cash carry forward or reserves.
yes, yeah.
And what's that do to our reserves number?
So that did have a calculation. Based on it. So there's also a multi-year tax advance on the table for the nursing center to pay back vendors that are currently owed. And doing that tax advance and using the cash carry forward to balance the general fund budget, we would be at 3.365 million in reserves for the general fund. It's a recommendation from the audit team that we have half of our expense amount in reserves. We are far from that.
Very steep. You know, the other thing that I don't understand about that, if we don't know what's gonna happen soon until November 3rd. How do we? I guess we're gonna need that either way. But,
You're gonna need to prepare for the worst and hope for the best.
yeah,
Just because you approve the advance on the levy doesn't mean you have to take it.
got you.
Our plan was to get a consensus that the board wants to go that route. We weren't going to, because it's something that, it's uncharted territory. We've never done a multi-year advance, so I wasn't gonna bother Carl generate the documents and the resolutions if you weren't gonna go that route. I don't see that there's any other option personally, but
Again, for the committee's benefit, I would assume everybody understands the reason why we need a 6-month reserve. It's, we have to carry the budget for 6 months into the year, but we get any, need these every time. Elections, so. I mean, we do get monthly revenues, like it's not,
My point in wanting Adrian to talk about the cash rate forward is 3 million was used in 2025, posing 3 million in 2026, and that leaves us 3 million left. And if you utilize the multi-year advance of the levy, it's not sustainable, obviously.
right.
any other questions on the revenue side?
No, but I've never, I guess to me, understood this because we've got that set up for approval right now. I would recommend this committee hold off and come back to that. After we go through some of the budgets, and be sure we're gonna get the numbers we need to, unless somebody's got a different suggestion. I know we talked about that last year. I think that maybe that should be more, you know, we get an idea of what we got coming for revenue. Let's go through the budgets and see where everything stands. And then we can come back and address whether we need to.
Well, that's why I
look
have,
at one-
so this is where we stand in particular to the, with everything that we're gonna go through.
You scrolled out just a little bit.
And I know this seems like a big number for surplus, but you have to remember that the only, all of these funds are restricted. They are for specific uses. The only ones that are not are general fund, public safety, nursing center, capital, which there's $1.7 million worth of requests for capital fund.
That's what I'm saying, Adrian. I'd like to go through all that first and then come back to the revenue side. First,
Okay.
if it looks good, great, then, well, we don't have to, stuff.
So we'll start with 401 corrections. This is approved at committee. A lot of the increases and the salary lines were in the union negotiations contract. This was paid out of, this 300,000 was paid out of the capital fund last year. No, I'll address that later. So the sheriff did move that 300,000 for medical and dental for the county back into the general fund. So total expenses are up to 14%.
I wish something that being asked for $500,000 for the meeting was to correct.
$410,000 plus.
Mr. Bush, do you have any comments on this budget?
Nope. She pretty much asked for Adrian's plan, pretty much laid it out. The media approved it.
Would you like me to keep moving on and kind of go through every general fund department?
What's the committee's preference? I don't mind approving these bit by bit as we go through. There's funds. Well, having discussion about.
Yeah, I would agree with that. Just,
I struggled with 14%, why we couldn't try and shave a little bit in some other areas. Obviously, Mr. Bush's committee had to look at that. And discuss it. It's contractual. What's the committee's pleasure with, 401 corrections? So, you got a motion to approve, you have a second, any other discussion?
No, I was listening to who seconded. Yeah, who seconded my way.
Questions, thoughts? All those in favor of moving forward, say aye. Opposed? Motion carried. Law enforcement.
One thing I did want to point out, the sheriff's, requests were higher. And he came to me last week, I believe, and he was unaware of some retirements that are going to be taking place at the beginning of 2026, so that he was able to reduce his request by around $170,000
On these directions on.
on all 7 of his budgets.
Okay.
So law enforcement, again, union negotiations, contracts in place. Slight increase for the sheriff's app.
Anybody use that app?
For sheriff's app?
Yeah.
All the time.
Every day.
All the time. So overall for law enforcement, it's a 2.49% increase here.
So I got a motion to approve. Global, I got a motion to approve and a second. Any other discussion on that? All those in favor say aye. Opposed? Thank you. Motion carried.
For 403 Merit Commission, there was a slight increase in the advertising and publishing for recruiting video updates. So that increase was 3.51% overall.
Mr. Bush? Motion approved. So moved. I'll second. You got a second, Mr. Milders. Any other discussion? All those in favor say aye. Opposed?
701 courthouse building. There was a large increase in the maintenance line, and the sheriff did explain that within the contract, there was a longevity increase along with the COLA. So that accounted for the 9%. Overall, the increase is 4.45% in this department.
Take a motion to approve that one. So moved. Got a motion. And a second. Any other discussion?
I would just like to say that most of the got opportunity to tour the courthouse, has seen a lot of work that has been done. And there's a lot more work that needs to be done.
It's really good so far. So a motion and a second. All those in favor say aye. Opposed? Motion carried.
Public safety building, small increase for the maintenance. And overall, 4.25%.
What is that for outside of holding inmates so they're coming from courts?
Public safety.
Other-
So,
That's not the one across the city one courthouse?
yeah, they don't hold it on there. It's got the telecommunicators, evidence storage, the morgue is in a lower level.
Nice. Yeah, no.
Yeah.
What's committee's pleasure? So moved. I got a motion to approve over and a second. Any other discussion? All those in favor say aye. Opposed? Motion carried.
703, recreation and conservation. This actually went down
Praise the Lord.
1.23%.
I would entertain a motion right now.
So moved.
All right, I've got a motion, so here a second. All those in favor say aye.
Aye.
What else you like? Motion carried, wasn't much.
Okay, moving on to state's attorney, 801. So you'll see the highlighted line. The state's attorney put in a personnel request to increase just an additional 7.5%. And the committee approved it as, the 4% COLA for this year, an additional 3.5%, next year. Yeah, 7.5 now, so they got the COLA, and instead of giving an additional 7.5%, they broke it up, so they'll get the COLA 3.5% this year, so it'll be 7.5% for 2026, and then an additional 3.5% for 2027. That was the compromise.
And the reason for the ask is the public defenders are paid. Somehow we got the pay between the public defenders and the state's attorney's office off about $5,000. Public defenders are paid $5,000 here at Florida.
So jumping ship.
Right, yeah, the jumping ship, yeah. And Mr. Larson said last night.
Can I interrupt just?
Yes,
one
yes.
second? A large part of that is the state of Illinois gives the public defender's office a stipend that they can spend any way that they want. They use that to increase their wages. So it wasn't anything the county board did necessarily. So, sorry to interrupt.
That's right. So that's the reason that we that additional. And I don't know how it got, well, other than the 100,000 that they get from the state. Mr. Larson said last night they didn't think that had any impact on the wage disparity. But I haven't gone back to look and see where the wages got so far off. It was for the 100,000 or something. But he's losing attorneys going to the public defenders there and moving one floor and getting a raise. So that would be somehow we need to get that straightened out. If we can hold on.
And the state's attorney salary is approved by resolution. The state told us that it's July. So there's a 6.25% increase overall. The state's attorney salary is set July, but.
I'll make a motion to.
Okay, I have a motion to approve. And a second. Any other discussion on this? Yes, sir.
Are you approving 7.5 increase or the 4?
Okay. I just think we've gotta, this is our other side of our law enforcement thing, I think we gotta keep this stable, so we can work cases through and get finished. That's part of our, more, trying to do some.
Yeah, I guess it'd be, from my perspective, it'd be nice to know if that stipend from the state could help readjust them.
I want to Steve.
Oh, yeah, I agree with that.
No, state's attorney does not receive anything, it's just.
That's the problem. Yes, I got you.
So.
I honestly don't know where the money's gonna come from, so. Guess.
All right,
That's a consideration.
now we have a motion and a second. All those in favor signify by saying aye.
Aye.
Opposed? Motion carried.
Moving on to public defender. So the public defender salary is dictated by the state. Then there's a 4% increase for the assistance and support staff. And Mr. Lutz actually did agree to cover the increase for the support staff by contributing some of that stipend money to the general fund to cover that increase for the support staff. So that's outlined in the revenue section. So overall, it's 4.49% increase.
I hear a motion?
So moved.
Got a motion to approve, the second? Second, discussion? So you're reasonable? Hearing none, all those in favor say aye. Opposed? Motion carried.
I will skip over probation, that was approved last month. Moving on to 804 circuit clerk. This circuit clerk salary is determined by a resolution, so that's included. Originally, she did submit for a personnel request. I believe it was not approved. Yes. Okay, so that 4% is included for administrative assistant, and then the union contract increase is included here for the deputies. So overall, that budget did go down.
I would certainly. Motion to approve.
Moved, so moved.
Motion to second. I got a motion and a second. Any other discussion on that?
Just real quick, this is another situation where it would be nice if we could give a raise, because the lady that her assistant, can do Chanel's job if she's gone, but, we're trying to keep the 4% consistent. So that's all.
All right, we have a motion and a second. All those in favor say aye.
Aye.
Opposed? Motion carried.
So, Mr. Chairman, if I may, I'll stop us for just a minute. Because if I understand the process correctly, the budget summary, we're at 2.4 million, which is really arguably not enough.
That's overall surplus,
Correct.
right? So
The way you have all the numbers in, well, that's so far.
right, but the surplus that I was referring to is the general fund only.
Okay.
We're asked by the auditors to have a reserve amount of half of our expenses.
And that's
That's
the
just
3
the
million
general
cash
fund.
carry forward that's draining that.
That is
That's in this.
cash carry forward that we've used for the past several years, along with the tax advance. Will take us down to 3.365.
So if we keep going along and we improve all these numbers, 4% here and 3%, 7% over there, we're not gonna be.
We'll be at
okay, draining out the
3.365.
reserves. Just saying.
But the 4% was outlined in the budget policy that was approved earlier this year.
Unless we increase the revenue.
That's also an option.
But not only the personnel costs are going up, the other costs are going up also. So this all personnel related.
I would say personnel is the
The biggest.
biggest
90%.
part of it, yes, yeah.
And even at 4%, I don't want to go backwards to the budget policy, but even at 4%, it's not sustainable.
Yeah.
Yeah, I know you might not for this time.
It's not, and it's cumulative. You approve 7.4% this year. Whatever the budget policy approves next year, 3 will be on top of that number. It's not sustainable.
Yes, if I'm looking at it saying, well, if our budget summary, the net is 2.445 million. What's our target on that? Is it 2.445 million? If so, we can just keep going right along and approve all these one right after another. But if it's something more than that, then we need to find a place to chop, to cut, say.
But the budget summary, it's just. So cash carry forward is not always included in all of the funds. They might have money in the bank, but it's not necessary to bring that money into the budget to balance it. Cash carry forward is a budget balancing tool. So you can see like. For the general fund specifically, if we use the 3 million in cash carry forward, if we do the nursing center tax advance, we'll have a reserve of 3.365 million. If we don't use, I mean, we do have more than 3.365 million sitting in the bank right now. So it's not necessary to bring in all of the money in the bank to balance the budget. And that's the goal. You want to have that cash reserve. So everything kind of has to be looked at individually when it comes to the overall budget. Because so many of these funds are restricted. It's 911 money has to be used for 911, period. We cannot take this 300,000 and allocate it somewhere else. So I just want to drive that point home. I don't think we have a number in mind to have a surplus because each individual fund is so individualized and restricted to what it can be used for. So we have to look at each one individually.
So should we go back to anyone's budget that is over? That anyone that increased their budget, should we go back to them and say? Because we can't go through line by line and say, well, okay, well, we're not gonna give you. Photocopies, you're charging too much, you got too much for photocopies. Do we go back to the
No, that's up to these individual committees.
right, but that's what we're gonna do, is that what we should do, is tell them, we have to have a zero increase, I mean.
Yeah, we'd have to go back and say, you know what, no, maybe we can't approve this increase sheet, find ways to cut that.
So is that what we should be doing?
Well, I think that's something that needs to be determined. I think, as the chairman pointed out, we need to be looking 2, 3 years, 5 years ahead. And that's something that we need to maybe determine when the budget policy process is coming forward. Based on the past 5 years and what our reserves were, do we think we can afford a 4% increase for non-union employees? That's something to consider. We understand that the cost of doing business and the cost of goods and supplies and things like that has increased over the years, but is it really 10% every year? Is it really 5% every year? I mean, kind of gotta look at things like that as well. There are some budgets where personnel is the only increase. And so when you say I have to have a flat budget, okay, well, just using administrative services for an example, Georgia's office buys supplies for the whole county, paper, things like that. So it's like, okay, well, if she needs a flat budget, what's going to go?
Right.
A countywide supply, we don't get something, it's just. So it's definitely something that we need to be forward thinking, that this is not sustainable because we can't be increasing our budgets exponentially every year. It's not, unless we're willing to increase taxes.
Right. Well, that's the kicker.
Right.
Yeah, if you're gonna have a 5% increase, yeah.
Or if we want to move capital improvements down the totem pole, and we're not gonna do that for 3 years. So no new, sheriff's vehicles, any improvements that anybody needs, nope, not gonna do it. I mean, that's an option too. I mean, right now it works. The overall picture, it works. I don't, obviously not all the supplemental requests are going to be funded. It's just not gonna happen. We don't have that cash flow, but those are definitely things that need to be discussed during budget policy time next year.
Yeah, we have personnel, to not being, like somebody retires, not being able to retire. Maybe have some of these live too. I made things like that.
Involved, but just sitting here and listening, it takes me back. And I brought it up before, Like the security plan, where are we at with that? I think that played a very important part in what we try to do. What's the plan? Where we gonna go?
Well,
Good question.
at this point, unless we haven't discussed that at length, Mr. Bush, I'm with you, Pete. But it's difficult because now we're late in the game too.
And I agree, and I think that we should have done this before we got to this point.
Right. Maybe that's something, in the future, we need to look at having like a pre-budget review meeting before we can get into discussing this and look at the strategies around what we're gonna do with the budget.
Cause you gotta have a roadmap where you going.
Exactly.
It wasn't that many years ago when, the budget was, I think they asked everybody to reduce their budget by 10 or 15%.
That was in 2019.
Just maybe you can look at that again.
Oh, I have to.
Well, quite honestly, if I can, what happened is COVID happened. So we got a large injection of ARPA funds and
Yeah.
other items. Otherwise, the conversations we're having now, we would have had 2020 and 2021. Okay, we just basically took a pandemic pause and had all kinds of excess funds. And we were spending it as though it was normal and it was always going to be there, and those funds are gone. But all through that, large wage increases were put into effect. You know, we funded the courthouse and got that repaired, which is all necessary things, but now we're back to the normal revenue levels. But prior to that, we were approving 3% increases through the budget policy, but we've been doing 4 for quite a few years now.
Well, from what I remember, you know, I'm aware that the county employees are not over, I don't know about during COVID, but you know, the wages were very low before COVID.
You really can't compare us to private sector though. We don't make anything and sell it, so.
Right.
You know,
Definitely.
you have tax dollars, right? So,
State minimum wage did
yeah,
also
state minimum
increase
wage increase
significantly
went
during
from
that time.
$9 to 15 over 4 or 5 years.
Double.
So then a lot of the employees who had longevity that were making less. That was cumulative increases as well.
The revenues just didn't keep pace. That's the issue. It's not whether they deserve it or not. It's just the revenues are not keeping pace.
So, yeah, it's really gotta be, we need to address that during the budget policy. Right?
Yeah,
Should,
and we can come up as a county, like Ronnie had said, in the intent of the strategic planning, but at the end of the day, the department heads still need to fund their departments regardless of what our priorities are. And they're always going to continue to ask to do that, and they should, rightfully so. They're performing services and they need to be funded to do that. But strategic planning is basically for us to stick to our guns and say, this is the priority, this is where the funding will go. But it won't stop departments from asking. So.
Yeah, it's a tough thing because people expect our government or the services that we expect.
Well, ideally, you want to cut little by little each year, not like we had to in 2019, where everybody had to take a 10% reduction.
Right.
That, I went through that process. That was probably the worst exercise I've been a part of. It was awful. And it was a shock to everybody.
Right.
But we can foresee this coming again. So now's the opportunity to try to limit that pain. All at once, I guess.
Forward with judicial.
Well, we are, we approved the circuit clerk, correct?
Yes,
So yeah, let's discuss the issues.
judicial is flat, so no increases this year.
Oh, how about perfect timing on that? I would entertain a motion to approve that.
I would make a motion to approve that one.
All right,
Second.
here's a motion and a second. Any other discussion? All those in favor say aye.
Aye.
Opposed? Motion.
Court ordered expenses approved already, so is jury commission, so we'll pass those. Law library, this was sent back to committee because of the increase. And an explanation was provided by Ms. Parkinson. Just at the cost of Westlaw and,
Westlaw.
was that the only increase or was there another one that's built in?
Thought Westlaw was the main.
It's the additional services through last law.
Okay,
It was brought up in committee that we have not gone out, because there are other companies that will supply the legal information where you can get online, but it's what they're doing now, it's all online. But, we have gone out for any kind of an RFP or look into, really, anyone, no one's looked into a different service. Mr. Larson thought there were probably cheaper ones, but he said with the caseload that they have and the amount of staff that they have, they really need the best service we can get. And, but we wanted to make, he wanted me to make sure that Mr. Headley suggested I bring that up in today's meeting, that we have not gone out and shopped around for another service. Maybe that's something we should, I can't do it now, but maybe it's something in the future.
I listened to that meeting, Mr. Larson said, he mentioned the other two, and he said they basically didn't work as well, they were slower. And didn't have the information in the right thing, so it would take a lot more time to use those other services, even though they might be cheaper. That's what I heard.
Right, I don't know if he's actually looked into that, I think that's, if he's actually looked into it.
I think that's what he was saying,
Yeah.
so.
So my question on that would be, what is the impact? So if it goes slower, then just to take longer to.
It's longer to look up the information,
So the man hours they were paying.
Yeah, all that kind of stuff, so it's like, well.
I think he talked about the updates being like all the
More
time,
recent.
less law. like,
Well, yes.
Daily, and he said it was like,
Yeah.
it's fun, you know, that as case law was passed, it was updated.
And all three departments use this service.
Right.
And I look at those three departments, and you got one already, 6.25 increase. Inflation is actually down. I never said 4.5. Something's got to give, it's done. Based on our discussion just a minute ago. Maybe that's a place we could shave some dollars. Because we approved the budget last year in 2024. 35 and then up to three items.
But the action was 42.
Well, that's what I'm saying. It's almost 43. So we approved 43 last year. This is again another $3,000. I just see.
He said you got the email from Land Apartments and there's no how.
But some of them. Not a good thing because it probably takes up like a copier, you know, they can save stuff that they're not. Right, so.
I just, to me, an online service like that, I imagine they've got some costs in the background for certain. What's committee's pleasure?
Well, I would make a motion to approve it.
Okay, did I hear a second? Second. I had a second.
I don't know if there's anything else in that line that they could reduce. Yeah, it's one line, so.
Well, take it. No, they used to have books on the shelf, they could look at.
They still do, but they're not
No,
updated.
that takes the DS.
They actually said that it's much easier to use now because the AI is,
Yeah,
you don't have to talk like a lawyer into the thing and it's, we're searching.
AI.
The AI helps them on the online stuff.
Yeah.
So it's.
The AI isn't included in that.
Because
What's
costs
the
should go
law?
down, because they're not paying people to update, usually ask them.
Hopefully that would be the case.
Both, but no, I don't.
All right, we got a motion and a second. All those in favor say aye.
Aye.
Opposed?
County board expense, there were no changes, so this is flat.
Love to approve. Second.
You got a motion and a second. All those in favor say aye.
Aye.
Opposed? Motion.
County clerk report was approved, election expense approved, county treasurer was approved. On to supervisor of assessments, the department head salary is by contract. There was a personnel request made for the deputies and chief deputy, and it was not approved at committee, so there is a 4% COLA included here. But overall, this budget did decrease.
Yeah, there was an additional 2% request and line. Section 39, so. All awesome.
So you make a motion to approve?
I will make a motion
I have a motion to approve. I hear a second.
I second it.
I have a motion and a second for a minus 0.23% increase. All those in favor say aye.
Can I ask one question?
Wait, whatever, sorry.
What, do you know what they cut to, how did they lower what did they cut out
Well,
to?
I think part of it was we cut that 2%, extra 2% they were asking for on the second and third item, the deputies, and chief deputies.
Right, so they also had the photocopies that went away,
The advertising and publishing right now.
countywide 5-year plan with access
Okay.
systems.
I believe there was another part-time employee included in this request also,
Right.
25,
Yeah.
so that was taken out.
Okay. Yeah, I just wanted, if we have if it's, I'd like to know how someone reduced their budget if, to go through these, to see what maybe we can do in the future.
She decided not hiring.
Okay. Thank you.
Yes, sir. Any other things? Yeah, all those in favor say aye.
Aye.
Opposed? Facilities.
Yes, and board review was approved, administrative services, so facilities management, I compiled this budget based on the expenses that we've incurred through this year. This is just our best guess, the 30,000, so I did reduce that to 22.5 and then increase tools and equipment a little bit. This can be changed at the committee's pleasure. So just kind of preliminary numbers. But it did, there is a reduction.
Rick.
Make a motion to approve.
Have a motion to approve. Second, I have a second. Any other discussion? All those in favor say aye.
Aye.
Opposed?
So moving on to 914 zoning, no action was taken at the committee level because of the possible addition of a building code inspector. What can be done is we can say that there will be a new line, put an amount in there and move forward. If it's not used, it's not used. If it's, I don't know, if anyone wants to speak to that or. Would you like?
Please do.
Yes, the new building code inspector line would be, if you remember correctly, we passed the chapter 218 ordinance from the health department to the zoning department. Now we have approximately, I think now 5 buildings that we are going to need inspected right off the bat. I spoke with him the other day. He stated it could be a potentially up to $3,000 or more per inspection because of if they don't respond to the first one, then they have to go in for a second one. Then if it goes to court, then he has to appear in court. We would more than likely send this to our hearing officers as well if it goes that far. I as of right now, we have 5, so this is the end of the year, I can't do anything from the beginning of the year. If we do 5, that leaves, I don't know how many more we get next year. So I'm leaving at the mercy of the committee to decide what we should fund in that line. If we do 5 at 3,000, that's 15,000 right there. Right. But we have this, and it seems like more and more people are complaining about residences and things like that. It's not something that Nicole and I look for. If we see something that is down a long lane and it's uninhabitable, we're not gonna go after it unless someone files a complaint.
That's the dream.
Also, I did reach out to a couple other counties. They tried to recoup some of the costs from the individual as well. So when they do go in front of the hearing officer, that is a fine. A stipulation that they would have to pay the building inspector costs, any costs that were incurred during that process. Not saying we're gonna get the money, a lien would be placed on the home or the property if we don't receive the money. Eventually, if the property sells, we will get that, but that's a big eventually. Right.
If I were a betting man, I'll find myself back at this meeting. The motion to dissolve the debt. That we would forgive the debt, that we won't get money to. Pay for that. I see the need, I don't see the money.
Yeah, I have to say, I agree with that. So I got a property right next door to mine, I wouldn't mind having.
On the list.
Got burned. February.
And Beth, wasn't your email 10,000? So was it that? That it could be. I was looking for it, I can't find it quick.
So he's $300 an hour, up to possibly of 10 hours or more for each site, so.
I'm sorry, 10 hours.
Yeah. And for those that aren't from my committee, we did put out an RFP. We did not get one response. I found this gentleman through an IBEW contact that visits our office monthly. I reached out to other home inspectors in the area. It's not the same as a building inspector. They don't hold the same qualifications. I thought it would be a home inspector and qualified, but they do not. You have to hold different licenses and titles, so. There aren't many around.
And if we don't approve it and we don't hire someone, then the people just continue to
They just
listen.
don't get the.
Right.
She doesn't get inspected.
Well, we wouldn't be hiring someone that would be an contractor.
Right,
It's like the hearing officer position, basically.
Well, okay, it's a service.
right.
So.
And there are homes that need inspected for DCFS purposes. We've received 2 calls from DCFS. I believe it was an email from Mississippi Centers requesting an inspection for one of the homes as well. There's children living in the one house and their walls are open to the elements on the outside and their plumbing is open to the elements on the outside as well. So it's,
How many DCFS homes do you have? 2?
I have 2 that I'm not sure if health department took care of the one last year. I was going to follow up on that one, but as of right now, there are 2.
So the 6,000 that's budgeted would potentially take those 2.
Possibly, yes.
And you mentioned the health department, I think at our meeting. They won't do them, they don't.
No, unfortunately, it was one of the ones that I have to send another letter to was a complaint. And health department was supposed to do an inspection. They did a visual inspection. Said that they couldn't determine anything from the roadside. Looking at the house, you can tell it's uninhabitable and it's dangerous. You can just, I mean, there's holes in the walls windows were missing, things like that. So we just got a lot of pushback. Nicole and I talked with Chairman Helms, Mr. Jokers, and said that we'll take over the code. Everything was rewritten by Attorney Bordeman, and so here we are. You know, I understand that we are in a deficit. We need to save as much money as possible, but if we have an ordinance, we need to enforce it. We just have to figure out how to fund it, unfortunately.
Can we pass that bill back and we see if that's, they request that?
I'm not sure.
So there.
I don't know if they have the funding. I don't know. That's a good question. I don't know.
But it's not, it's the first service.
Right. Yeah.
So.
That's a good idea.
Did you talk to him about, not having an open-ended contract, that there would be limits, to the total expense?
I did, and he says he does not do that because it could be, this is just broad, the 10 hours. It could be a 5-time court case that he has to go to each time, so that's accruing his time, you know, unfortunately. He's not.
We're talking like an annual amount or a case amount? Dollar. Well, yes, but, a case amount more, because if we say, well, we have a house here and we have a house here, we've limited his employment, so to speak, to 2 cases, right? But we don't have a limit on how many hours he might spend on each case. Yeah. That's the question.
Beth, can you talk about how much fee income goes from your office to the general fund on zoning applications?
Yes, all of our zoning applications, $275 from our ZBA applications, so all of our building permits, sign permits, fence permits, solar permits. ZBA 275, all of that goes to the general fund. Just last mention, I'm sorry. Total amount, right now, we're at 67,000.
It's on the screen.
It varies, like last year was at 230 I brought in, 201 the year before. It varies. If people are building, we're getting the money. If people aren't building, we're not getting the money. We have been issuing a lot of late fees. That's helped. If you build without a permit, you get a minimum $200 late fee right off the bat. Sorry, I'm not reducing it. You should know better. Also, with the solar, the big solar builds, that's anywhere from $36,000 to $50,000 per building permit. So that's a big help.
So the thought process when we went through this and we changed the code was zoning could fund inspections with the dollars that they bring back into the general fund, leaving zoning, going into the general fund, being distributed throughout the county. So there is a funding mechanism for this. And last thing I'll say about it is there is a house in Scioto Mills that was purchased by an individual who lives in the city of Freeport, with a construction business that takes his construction debris and dumps it into the yard of the house he purchased in Scioto Mills. It's full of, it's just full of it. He won't do anything with it. The house has come off the foundation.
Yep.
I don't know if anybody's ever been to Scioto Mills. It's a nice little area.
That's what I'm
Until you
looking
see
for.
this house. And the neighbors are sick of it,
Yes.
tired of it, understandably. And this guy just keeps taking his stuff up there and dumping. That's why we have the ordinance to stop us and to not do our job with things like that, or the house by you that burned down and is just standing as a shell. When we have a funding mechanism in place through the zoning fees.
So is that a good number? Then we want to.
Well,
Yes,
I guess, I think he's saying, right, you know, I mean, you could put 10 in. it just, it makes the overall budget that look, well, it's a pretty ridiculous spend. And, I mean, it's a special edition, it's something brand new, it's not something that.
So you've got five right now. $6,000 for five doesn't sound like.
Yeah.
That's very impressive.
Well, would anybody like to make a motion on it? Specific to that budget and or budget and minor?
I'll move to approve the zoning budget with 6,000, that's the line item for building inspection.
Second that.
I have a second. Any other discussion? All those in favor say aye.
Aye.
Opposed?
No,
No. Econ development.
This is flat, nothing is changed.
So I have a general question on that. You know, and when we get reports from GFP every month. But Mr. Chairman, do you think of a better way we could spend that money? Or do you think it
What that ends next year.
ends next year? So we gotta.
50,000 comes out of the general fund, 50,000 comes out of New Race Crossing.
Gotcha.
So two things with that, you can exit the agreement before the maturity date.
Okay.
There is a clause in there to end the contract. Again, it goes back to what do we want to do? Economic development is a component of revenue within the county. You need to have economic development, right?
Right.
Could not hire someone to do the job that we're having GFP do on our behalf. Expect substantially more of that with salary, with benefits. The other thought was by working with GFP, who also works with the city of Freeport, a number of other groups, it's one concerted effort. So everybody's pulling in the same direction for the greater good of Stephenson County. Maybe it's all in Freeport, maybe it's in the unincorporated areas. But you don't have Stephenson County doing its thing, not coordinating with the city of Freeport, and the city of Freeport. So is it a need? I suppose that's subjective. You decide if it is or it isn't. One thing to keep in mind with that is the economic area district, which we like to call a TIF out at Mill Race, is going to expire, I believe, in 2027, which means there will be no more increment being generated for us to use for GFP or the debt on Mill Race. So something else is coming down the pipe. And in order to extend that economic area district, you have 10 total taxing bodies that would have to sign off on basically giving up the tax revenue that is generated by Mill Race Crossing for another, whatever, how many years you extend it. I'm thinking with what had happened in 2020, when there was an interfund loan from Mill Race to prop up the nursing home, which is not in that economic development district, and it did upset a number of those 10 taxing districts. I highly doubt that they would sign off on extending it. We also need to have 2 Illinois legislators present that to the state for review, because it was created in Springfield. It's not anything that's created here. Jim Seisha and John Bill created that.
Yep.
2003 or 5, 6. So that's my long answer to your GFP question.
Thank you. So this year there's a 0% increase, but that, I wanted to hear that because from what I see, there's been a minimal impact in like industrial development, things of that nature. There's been a decent amount of coordination in the arena of, some of these